Everyone's concept of beauty is different. Some people like to have really white teeth. Some patients want a more natural look. Some patients want a better alignment of their teeth. Their teeth may be crooked. Maybe they don't want to go through braces. Their teeth may look worn or shorter than they used to. We can make them longer, straighter, better shape, better shade. It just amazes me today what we can do with a smile. And I always want to give patients ultimately what they deserve and desire. And for each person that's different.
Probably most of my adult life, I've been uncomfortable with my smile. I never liked the color. I had braces when I was a kid.
Eva has not had any trauma or problems with her teeth in general. She just has been unhappy with her smile over the years and is at that stage in her life when she can do something about it and wants to. Her two front teeth are significantly more prominent and stick out a little bit further than her other teeth. Is it the two front teeth that primarily bother you?
Primarily, but the next two teeth are a little bit further back. Okay. I know that they're not straight like they should be.
Smile for me. So your two front teeth kind of protrude a little bit, and then the rest of the teeth kind of set back. Mm-hmm. So if we could bring those teeth out a little bit, these two central ones back a little bit and even that out.
Right.
Because you can tell when you smile, actually, your upper lip is a little bit sticks out. You want your upper lip to stick out a little bit there because as females we like to see that smile fullness there, but then it's not very full in these areas here.
Okay.
I like to feel more comfortable with my smile because I often hide it. I don't realize that I do, but sometimes I do, yeah. I always feel like there's something in between my two front teeth, and at certain times it's weird, but I can actually blow bubbles between my two front teeth while I'm talking, and that's very embarrassing.
Okay.
And I don't know of anybody else who does it.
What we can do with her is decrease the size of those two central teeth, balance out the shape and the size with the other teeth in the arch, and then make a beautiful frame with the lips involved, so when she smiles, you just see a pretty smile. You don't see two front teeth. Now, do you want your teeth whiter than they are currently?
Yes.
Okay.
I don't want somebody to know that I've had work done necessarily, but I do want them whiter.
Okay.
I like to see white teeth. I like to see fairly straight yet natural. Genuine, not hidden, comfortable.
I like for people to look at patients and say, wow, that's a beautiful smile, not that you have done something to your teeth. I tend to go a little bit towards the more natural look. You can make teeth really white and not make them look like chiclets or picket fences.
The unnatural look to me is unattractive.
You can have them that white, but let's put a little anatomy in them so that the light can hit them and reflect back to you, and then it looks like a real tooth. So if we soften that and then whiten the teeth, we can also blend that really well. We have TVs in all the room, HD televisions, mind you, with Apple TVs connected to them, that allows patients to pick and choose from an enormous library of music, of downloaded books, of movies. The picture is up there on the big screen TV, or the music is coming through a set of wireless silencing headphones. And when they're listening to music, this series of photographs comes through of flowers and real peaceful types of things. So patients are pretty comfortable when they come here, I have to say. I think we strike a happy middle ground with what we're trying to do with making patients comfortable. We're doing great dentistry here, and I just want to do that with patients at their utmost comfort and getting what they deserve and desire.
Okay, when do we get started?
Well, that depends on you. We need to take a full set of records, photographs, radiographs, impressions. Some patients will come in and talk to me and get some information, go home, think about it. I give the patient the information they need to make an informed decision, go over any questions and concerns they have. You know, I've had patients come back a year, 2 years later and come back and say, I'm ready. When you leave here, you'll be in plastic temporaries that will be very close to what we're going to give you in the end product. Eva will leave here with a set of temporaries. Those temporaries have been fabricated from a model. It's a mock representation of where we're headed with Eva, what we want her teeth to look like, the shape of those teeth. Does that feel good? Does it look good? Is there anything we want to change in it? They are made out of plastic. They're not the real thing, so it's a good way to determine, am I understanding her desires? Is this what she's wanting?
Can't feel my face. Oh my God.
Oh my God.
Wow.
I think you can tell where they're headed, so.
They're beautiful.
Yeah, I see your midlines are evened out, everything.
Okay. Good job.
Thank you.